most famous physical therapist on the internet.
Hi folks, I'm Bob Schultz, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to fix a tight lower back in 30 seconds.
That's right, Bob.
We're going to actually, you have to decide which exercise works for you, and we'll talk about that, Brad.
Right, you're going to have 6 options, and for sure at least one of them is going to do the trick.
Right. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com, go to the giveaway section. Always giving something away. This week we're giving away some Bob and Brad exercise bands and also the wall attachment, the wall anchor that you can attach to the wall, and you can do your wall exercises from the wall then.
Wall fitness, Bob.
Yeah,
it's incredibly efficient and fun.
Yeah, go to Facebook, and the contest will be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
TikTok.
We also have Bob and Brad Clips now, another YouTube channel.
Oh, really?
It has 60-second clips.
Excellent job. Yeah. I like clips, Bob. So anyways, we're talking about tight low back. You know, if you feel like you got a tight low back and it's stiff, and once you get it loosened up, it feels better. But oftentimes as therapists, instead of doing a whole barrage of exercises, it's nice to get the 1 or 2 exercises that hit that tight spot. And we've got 6 options. Do all of them as we do them with it. You're going to find out if they hurt, create any pain, that one's off the chart.
Right.
You don't consider that one. If it makes it feel better, the more you do it, that's the one you're going to put on your to-do list.
It's a directional thing.
That's right.
Trying to determine which direction feels the best. And the other thing, I hope it's okay, I recommend this, Brad.
Oh, sure.
The idea is that you do these once a day.
Right.
The idea is you do these throughout the day. And that's why we usually pick one.
Right.
And usually why it only wants to take 30 seconds. You take 30 seconds out of your day, do the stretch real quick, and then move on. And you're going to have better results by spreading out over the day instead of doing one long workout or stretch.
Right. And that goes for a lot of our stretches,
yes,
Bob, especially our posture stretches.
Yeah.
So shall we carry on, Bob?
Sure.
Now, again, these are showing success with us personally in the clinic with our patients. So they're the real deal. Can you, you're going to have to.
Oh, I was going to say, do you want me to do any of them?
You want? Yeah, go ahead. You
well,
do
no.
this. No, lay down, Bob. I prefer hook rotation.
I'm going to lie down.
Lie down. Oh, I would have got an F on that.
See how I got in correctly?
Yeah,
I did go in like this. This puts a lot of stress on the back.
Yep.
You go onto your side, bring your feet up, and then roll over as one log.
Yep.
Just don't roll off the bed.
You want to. Now, you can do these with a pillow, but we're not going to now.
Yeah.
You can do these in bed even, these particular ones in bed.
Brad likes to refer to these as windshield wipers because basically you're putting the heels, the ankles together, and you're cleaning the windshield off.
Knees stay together.
Yeah, my windshield had snow on it this morning, Brad.
Well, so did mine, Bob. We're in the Northwoods.
Now, if you find out that one direction is painful, avoid that one to start off with. Let's say it hurts going to the right. I'm just going to go work to the left for a while, and then eventually I'm going to try it again to the right. And surprisingly enough, sometimes just by working the left side, the right side also maybe improves a little bit.
There you go.
Or it might take a couple days, but this one is a good exercise. Almost most of our patients can do this one. Most, especially with a stiff back. It's very benign. It's not that hard on the back.
Right. Yep.
And you don't have weight bearing on, so it's a good one to do. Getting the movement in the back and getting some blood flow going.
Yeah. 10 to 15 repetitions typically is enough. You can do more if you'd like to.
Yep.
Okay. Number 2, stay right there, Bob.
All right.
This one can also be done in a bed on a soft surface, or you can do it on the floor. But we're going to start with single knee to chest and then work to double knee.
Now, I don't know how long your arms are, so you might have to grab underneath like this.
Yep.
You might grab above like this.
Mm-hmm.
You might actually need a towel.
Sure.
There's one right there, Brad.
Oh, you want me to use that towel?
Yeah. So you can actually have the towel in bed with you, and you can just pull up like this and give it a stretch like that.
Particularly for some people that are a little older, and depend on your body proportions, it's you need that extra help.
Now you may want to go progress to the double knee stretch, and so you're going to bring the first one up, and then bring the second one up. I don't like to bring both of them up. That just puts a little stress on the back. So bring the one up, bring the second one up, and now you can do a little bit of even stretching and rocking back and
Right.
forth if you want to get a little more.
If you happen to have
Nutrition.
spinal stenosis, this one is probably going to be one of your go-to ones.
Right, or spondylolisthesis, which I always say wrong, but that's Brad's
Spondylolisthesis.
Yeah.
I think I got that right. I even talked to a doctor about it once.
Okay. Where are we at now, Brad? What's number 3?
Okay, now we're going to lay on your stomach and go prone. Now this one you can
lie on my stomach.
Lie on your stomach. You can do it on a softer bed, but you shouldn't. You should try to do it on a carpeted floor is your best bet.
And so you can start off by, you're going to have your hands probably about shoulder width apart. And you're probably going to start with just doing some micro press ups because you haven't done these before. Some people even just start by getting up on their elbow to get used to it. But the key to this is not to have your pelvis come up off the bed or the floor. That means that your back is so tight that it actually does need stretching. So you just work in the range that it allows you.
Right.
And then eventually you might be able to go up this far. If you're still coming off like this, go up to the point where it allows you to go and stop right there and go back down again.
Again, this should not create pain, particularly sharp pain. If it does, skip it.
You might feel a little bit of discomfort when you first start that, Brad. I mean,
right.
Give it a few repetitions.
Yeah. Right. If it gets better, clearly gets better as you do more, then it's the green light. But if it gets worse as you do more, you may have stenosis and may not even be aware of it, and that would be one indication that's you may have it.
You got the quadruped next, Brad?
Oh yes. Now the name on this one, there's controversy, Bob.
Yeah,
I call it the cat and the camel. Some people call it the cow and the horse. I don't know, but just demonstrate the exercise.
So there's a lot of different ways you can do this, but I like this one where you're going to basically arch up the middle back, but I like to bring the head down at the same time.
Stretching all the muscles. This gets from the low back, even in the thoracic back.
And then going up, I bring my head up the other direction, and I arch the back the other direction. I hollow out the back.
Right in here. I've got to admit, Bob, he's 60 years old, and there are not a lot of 60-year-old people who have a back as flexible as he does. Mine is certainly not near that flexible.
Well, I make it up for on my hips, and I have no motion in my hips at all. We all got crosses to bear, Brad.
Yep. Arch. So yeah, this is I guess this would be the camel part and this would be the cat part. But
I don't know.
Just go ahead and do it.
I see cats get afraid and they're going like this.
Yes. You used to have a cat.
Camels have.
Let's get on with it. We're getting off track, Bob. Okay, now the next one you can stand off. I'm going to. We can both show this one. It's just simply if you're walking, you get out of or you're sitting, you get out of your car, you get out of your seat from working for a long time, and you really don't have any back problem, but it feels tight when you stand up, simply arch backwards. Now, if I do this because of my spondylolisthesis, I don't do these because it'll hurt after I do it a few times, but you can see, I'm a little guarded here, but show Bob.
Yeah, you can do different ways. You can put your hands like this, kind of along the spine, or you can put palms on it like that.
Yep.
And brace against it, give counter pressure, and you're going to work it that way.
If you happen to have a towel roll or a belt, you can do that, and that support makes it more comfortable.
Right, it makes it a lot easier to do.
Now, all these we're taking time to explain, but you can do all of these easily
in 30
seconds, particularly after you do them a couple
times. This
one,
you had said like after you've been sitting for a while, or also if you did a heavy lift.
Sure.
Like you're bent forward, you put the back under stress in flexion. You want to go the opposite direction to even things out.
Right. Balance it out.
A lot of pregnant women do this automatically. They often do this because they got the load coming forward. So they're trying to balance things out and stretch it out the other way.
Did you have that, Liz? Did you feel that was a relieving stretch? Okay. So Liz concurs.
And
it's not just male.
She has three children.
Three children, right? That's a good
she's
sample.
An expert.
Okay, the last one. Now this one is going to offer a stretch in a different way. It's in
distraction,
decompression, or traction. For this, you need a pull-up bar or something you can hang on to. We have our hanging handles with the what the wall anchor is specifically for. This is for your back, your posture. It really is a trifold benefit. But for this video, we're going to talk about the low back. I'm going to gently go down. And you want to have it so when you're standing here, there's no traction. But I'm going to gently lower and lower. Oh, And there we go. I can feel that traction through my back, and I'm going to round my back forward and this way.
So
And
he's moving the pelvis basically.
yeah, and I'm going to go whatever feels best. You listen to your body. If it hurts to go this way, don't. It feels good.
So he's doing pelvic tilts basically.
Exactly.
So
And if you feel good, you can go full traction like this and just relax. If that may take some time. You just go like this for the first few times, and make sure after you're done with it and you hang for 10 seconds times 3, that would be 30 seconds, or after a while it might be 30 seconds straight. After you get up and you walk around and you move around, it should continue to feel good, because once in a while you hang, feels good while you're doing it, but you get up and move around and then it hurts. That's not real common, but if it is, then you're going to want to put a caution
that'd be
light
very
on doing it.
unusual. But I often do these as a preventative thing too.
Sure.
I'll be working at my desk, and I try to every 20 minutes or every hour, depending on how often I think of
Yep.
it. I'll go out and I just hang on my handles in the office, and my back always cracks,
Yep.
cavitates.
Yep. It's great for the
Yeah.
shoulders. There's a whole book written on doing this by a
Yeah.
orthopedic doctor, Dr. Kirsch.
For shoulders.
Yeah, and it's great for your posture because you're right up against the wall.
Right.
And you have perfect posture. So if your head's touching, all 3 points are touching. We can't say enough about that simple little
I
exercise.
think we said enough already.
Oh, we did. Sorry. Anyways,
Remember, Brad and I can fix just about anything
except for
a broken heart.
very good.
It's about time you get to it, Brad.
Be careful.
All right, thanks.